My name is Aisha Shehi from the National Health Insurance Company, Daman, and I am part of the disease management team. Thank you for joining us for our Breast Cancer Awareness webinar. Breast Cancer Awareness Month is observed every year in October by health experts, health advocates, and the public to raise awareness and support those who are affected by breast cancer. In today's webinar, we are going to shed light on breast cancer, one of the most common types of cancer that affects women, with a presentation by Dr. Deepti Kansal, Specialist Obstetrics and Gynecology in Ambulatory Health Services, SEHA. Please note that you can send your questions through the Q&A chat box anytime during the presentation, and we will allocate 15 minutes to answer these questions. It's my pleasure to welcome Dr. Deepti Kansal, Specialist Obstetrics and Gynecology in Ambulatory Health Services, SEHA. Dr. Deepti has over 20 years of experience in multicultural environment, specializing in women's health with significant contributions to gynecological education and research. She has strong commitment to improving patient care as well. Dr. Deepti, welcome. The floor is yours.
Thank you, Ms. Aisha. Hello, everyone. I think it's a very important topic, and especially when we are celebrating Breast Cancer Awareness Month in October. So that makes it also really important that everybody should be aware of what breast cancer means. Regarding in this presentation, I'll be talking about basically what is breast cancer. And before that, to give a brief layout, what is the breast structure and function? What are the causes and what are the stages of breast cancer? What are the risk factors of breast cancer? And breast cancer facts and statistics? And what are the symptoms which patient experience? And how to prevent it, and what we can do for screening and early detection of breast cancer, and what is SEHA screening, that is the periodic comprehensive screening program, which is for the detection of various cancers and chronic diseases, and the role of men in breast cancer. So breast cancer, before that, let's talk about the structure of breast structure. If we can see on the right, basically the breast is composed of fat and breast tissue. This purple, which is breast tissue, which is composed of these sac-like structures which form the milk, and then they are the ducts or the lobules from which the milk comes and is expressed out of the nipple. So the main function of breast is breastfeeding. So, and there are many changes that happen during the lady's life because of the hormones, and there are changes in the breast, and most of them are not very not to be concerned about. That is, they are because they are benign. Just a second. Okay, so what is breast cancer? Basically, what happens is when the abnormal cells in the breast coming from any part of the breast, it can be from the sac or the lobules, or then they abnormally start dividing and they grow out of control and they form a mass or tumor. That is what we call as a breast cancer. And as we know, like any other cancer, this breast cancer can spread to other organs and the body. What are the causes of breast cancer? The causes are not not all of them are fully understood, but we know that when there is any damage to the cells in the DNA of those cells, then it leads to abnormal growth of the tissue of the cells, and then that leads to tumor formation. It can be the gene mutations, that is any changes in the genes of the cells or hormones, and they can play a role in breast cancer. Only 10% of the breast cancer are inherited. Like we always keep, whenever you go to a physician, they keep asking that your mother or sister, they had a breast cancer. this because we want to rule out any risk factors are there which is like in your family, any cancers are running in the family, so that increases the risk. But most of them, 90% of them, are because of the changes in the gene on their own. You don't have a family history. But very commonly known genes which are related with breast cancer are BRCA1 and BRCA2, and which are running in the family. Now, what are the stages of breast cancer? Basically, when we want to stage the breast cancer, it depends on the size of the tumor mass and whether the lymph nodes are, like, if we see the size, whether the tumor mass is palpable, we can feel it or we cannot feel it, then whether the lymph nodes are involved, or whether it has gone to any other part of the body. So depending on that, we stage the breast cancer. As far as the numbers are concerned, in 2022, there were 2.3 million women were diagnosed with breast cancer worldwide, out of which 670,000 women died because of breast cancer in 2022. Most of the breast cancer, they occur in women. That is only 0.5 to 1% can occur in men. So if we see these statistics, it comes like every 15 seconds, one lady with breast cancer is diagnosed, and every 50 seconds, one lady with breast cancer dies because of breast cancer. If we talk about UAE and Abu Dhabi Emirate, it is the most common cancer in UAE. And also it is the first leading cause of death among women in UAE and Emirates of Abu Dhabi for the last 10 years. So we can understand the significance and the load which breast cancer has in the society, and the importance that we should refer to. What are the risk factors for breast cancer? Now, there are some factors which can be modified, like the lifestyle which we live, and there are some unmodifiable factors. The modifiable factors are like if you never had children, then it increases the risk of breast cancer. Or if you had first child after 35 years of age, that will also increase the risk of breast cancer. If you have taken any hormonal therapy in your life, like if you're taking birth control pills, that increases the risk of breast cancer. Or you're taking hormone replacement therapy after menopause, that is after you've stopped with your periods, that also increases the risk of breast cancer. If you have not breastfed the child at all, then it increases the risk of breast cancer. Then what you're eating, if you're eating more fat and more red meat in your diet, then it increases the risk of breast cancer. And if there is less of fiber or fruits, that also increases the risk of breast cancer. Being overweight or being obese, lack of exercises, it increases the risk. And also smoking and drinking alcohol increases the risk of breast cancer. Now, there are some non-modifiable risk factors, like those which you cannot change, like being a woman, the risk of breast cancer is more. Being older, or carrying BRCA1 or BRCA2 genes in the family, or there is a family history of breast cancer, or if you had a history of breast cancer or ovarian cancer before, that will also increase the risk. Then having dense breast, or if you had history of hyperplasia, that means the cells are growing too much, but they didn't turn into cancer, but that also increases the risk of breast cancer. Or having a small precancerous changes, that is something short of cancer, can also increase the risk of breast cancer. So now, what are the symptoms and what lady should observe just to go and see the doctor, which we are really concerned about? That is, if there is any, show this, we have taken example of lemon. If there is any hardening of the skin or puckering of the skin, or there is some skin erosions, which you can see, or there is redness or heat, means there's increase in the temperature of the skin at particular point, or there is strange fluid which is coming, like it is bloody, or fluid coming from the nipple, can lead to, you're supposed to go and see the doctor. If there is dimpling, or there is a lump which you can feel, or you can see the dilated veins on the skin, or there is a nipple retraction, or you can feel there is there's asymmetry of the skin which was not there before, or there is an orange peel changes, or a lump palpable. In these cases, you need to go and see the doctor right away. So most of the people will not experience any symptom when there is early disease. They will not experience any symptom. So that is the reason we ask the ladies to go and screen themselves, so that they can be early detection and early treatment. As I already talked about the symptoms, what all symptoms can be there. So in case of any such symptoms, any abnormal breast lump, you need to go and see the doctor. Whether it hurts or doesn't hurt, you need to go and see the doctor. So one good thing is most of the lumps are not cancerous, but to diagnose that, okay, these are not cancerous, we are okay with that, there are benign lumps, you definitely have to see the doctor. And it's always good to treat as early as possible, because that gives you, the treatment is better if we diagnose it early. So how to prevent the breast cancer? Now, all the modifiable factors which I already talked about, like having a healthy diet, quit smoking and drinking, alcohol, avoid hormones as much as possible, and engaging in regular exercise, breastfeeding, these all will help in decreasing the incidence of breast cancer. Now, how can we screen and do the early detection? Normally, we advise girls to start doing the breast examination as early as 20 years of age, every month after periods. Or going for the breast examination by the physician every 3 years after the age of 20 years, or every year after the age of 40 years. And normally we advise them to go for a mammogram after age of 40 years every 2 years. Now, what is SEHA screening or periodic comprehensive screening program? In this, the main purpose of this health screening program is to reduce the burden of chronic diseases, especially like cardiovascular diseases and common cancers. This is applicable. This is covered by the MAN for the thick-up patients and patients who have thick-up insurance, who are 18 years and above, and both for male and female, they have specific screening programs in this SEHA screening. The main purpose, the screening was started in January 2021. The main purpose is to screen the healthy asymptomatic population, the people who don't have any symptoms. It is to screen mainly for the cardiovascular diseases and the cancer. And in this, what we do is we take their history and try to find out if they have any risk factors which can be modified. And then according to the age and according to the gender, they undergo a certain specific test in this SEHA screening. In this, we normally look for oral health, musculoskeletal disease, and most common cancers are screened, mental health, cardiovascular diseases, and also for the elderly ladies and gentlemen, it is vision and hearing screening. And by the MAN, the 5 leading provider networks which are covered for this screening is SEHA, NMC, Mubadala, Burjeel, or the VPS, and Mediclinic. So what are the SEHA packages? It depends, as I said, depends on the age. So if we start from, we are starting from 18 years of age. So the youth who are between 18 to 24 years of age, for them, there are 3 screenings which are done mainly. There's the cardiovascular risk screening, the mental health assessment, and oral health assessment. In the cardiovascular risk, we ask a history about what are the risks. We look for the background risk, check their blood pressure, height, weight, and calculate the BMI. Check their weight and waist circumference and hip ratio, And then we conduct some tests like the cholesterol, the good cholesterol and the bad cholesterol, and the kidney test. And also we conduct the for the sugars, for the glucose test, how is the control for the sugars. When it comes to the middle age, that is after from 25 to 39 years, other than these 3 screenings which we do for youth, one more screening is added, that is the cervical pap smear, which is done for the married ladies from every 3 years. When we go to the middle age group 2, in which between 40 to 64 years, what we were offering in middle age 1, other than that, after 40 years, we add on for the mammogram, which is done every 2 years, and also there is FIT screening. FIT screening is basically this for the colon, the stool test, which is done every year for the colon, or colonoscopy, which is done for the colon every 5 years. And the last one, which is there, is for the seniors, that is from 65 to 75 years of age. In this, there are few more tests added, like for vision test, hearing test. For the bones, there's bone scan. Then there is ultrasound done for the abdomen to see for the big blood vessels and all. And also the last thing, which is other than which was being offered before, is the lung cancer screening, especially for those who smoke. So what is the role of men in breast cancer? Now, the most important role for men is to encourage women in their families to screen for the breast cancer, whether it's a monthly breast examination, or if the lady has history of breast cancer, to support them when the lady is undergoing the treatment. The risk of having breast cancer in men is like if 100 women had one breast cancer, one men will have breast cancer. So the incidence is not much in men, but in case they have the similar symptoms which I talked about, they definitely need to go and see the doctor. So what is the purpose of this presentation is that we would like that if you find any change in the breast, though most of the changes are harmless, but if you find any change, go and see the physician. Don't ignore them, because the doctor needs to determine whether there is any problem or it's just a benign change. So it's very important. Okay, so it's very important to do the regular checkups, to undergo regular checkup, and so that when you're undergoing the screening, the regular checkup will lead to early detection of breast cancer, and early detection of breast cancer can lead to saving lives of the people. So it's very important for us to, if you find any change, please visit the physician, or if you don't find a change, just go for the regular checkup for screening, so that there can be early detection and early treatment can be done. So this is that is a reason of it, because there is so much of burden of breast cancer in the society that every year we are doing the breast cancer month in October, and all the AHS healthcare centers are providing the mammogram free for all the insurance for the ladies above 40 years of age with any insurance, and they can either call up 850 or book an appointment. Thank you. I'm open for the.
Thank you, Doctor, for such an informative presentation on one of the most common types of cancer. You have shared crucial information regarding various stages of cancer and the importance of regular screening. Now we will be moving on to take the audience question. And Doctor, for the first question that we have is, what's the best time to do the self-examination exactly? Immediately after the period or after 2 or 3 days? Sometimes we feel some changes or pain in the ovulation days. Is it normal?
Yeah, very good question. That see, immediately after the periods, you can check your breast, and because of the hormonal changes which occur during ovulation, sometimes some ladies may experience some pain in the breast. That is normal. So that is fine. It means after the periods, 1 or 2 days, it's fine. It's not mean. No, it immediately doesn't mean that you have to be the same day when you're finishing a period. Within 2-3 days is also fine to examine the breast. But what is most important that you, once you start examining your breast, you get used to then how it feels like. So once you're used to it, then anything which appears a bit different, you're able to make out. So that is the reason for we say, okay, start examining the breast after 20 years of age, after periods.
And that, doctor, takes us to our second question. What do you mean exactly by dense breast? Is that a hard breast or a bulky one?
No, dense breast, basically what happens is, like, all the ladies are different. So some of the time, many of the times, the breast tissue which is there, like as I showed you, that there are different breasts with how much is a fat content and how much is a breast tissue content. So there are different breast tissue content that which can change the how the breast feels like. So when there is more breast tissue content, definitely you tend to have more chances of having breast cancer. It is not hard breast. It is not hard. Consistency means, but because the tissue is such, because like how we have 5 fingers, everybody has a different no sizes of fingers. Similarly, the breast tissue has a different consistency. So that is what it is.
Thank you, doctor, for clarifying that. And moving on, what is BIRADS 1, 2, 3, and 4?
See, BIRADS 1, 2, 3, and 4, when we do the mammogram, so it is a gradation given by the radiologist who reports a mammogram. So to standardize that we are reporting in our clinic and what other is reporting in another hospital, just to standardize this, they have given this BIRADS score 0, 1, 2, 3. 0 basically means when the investigation is not complete. They want further investigation to be done to tell that it's normal or not normal. That is called as BIRADS 0. Now BIRADS 1 and 2 basically are normal breasts. When it comes to 3, that means there may be a benign lesion. Benign lesion means something which is not cancerous, but we need to follow it. When it is 4, then the suspicion arises, okay, that it may not be normal. So most of the time when it's BIRADS 4, we ask for the biopsy to confirm whether things are okay or not okay.
That was a helpful explanation, doctor. Doctor, another question. When can we do the BRCA 1 and 2 test?
BRCA 1 and 2 tests are basically when you have especially the breast cancer and ovarian cancer running in the family. Especially there are some cancers which are quite dangerous, like in the breast also. There some are like means they are going to the other parts of the body very fast, or they're occurring less than 40 years of age. So then your the person who's diagnosed with who are diagnosed with breast cancer, their physician, the person, the oncosurgeon or oncologist, they will advise for BRCA 1 and 2 to be done. Or if they have many members of the family who are affected by breast cancer or ovarian cancer, then they will be advised by the oncologist that you should go for BRCA 1 and 2 testing. Because most of the cancers, as I said, 90% of them are not running from the family. There is no history before. So BRCA 1 and BRCA 2 may come as negative. So that depending on the situation of the person, the oncologist will advise whether we need to do BRCA 1 or BRCA 2 or not.
Understood. And doctor, we have another great question regarding the risk factors. So is the pregnancy after 40 one of the factors of breast cancer?
No, the pregnancy happening after 40 years is not a risk for breast cancer. If you did not have pregnancy before 35, you did not deliver, because what happens is when you feed the baby or you were pregnant, that decreases the risk of breast cancer. It is not having a pregnancy after 35 this increases the risk. No, It is basically having a pregnancy before 35 and delivering before 35, it decreases the risk of breast cancer, basically. So if you did not have baby till 35, then the risk is more of having breast cancer.
And doctor, talking about pregnancy, is there a link between oral contraceptives and breast cancer?
Oral contraceptive pills, any hormonal for that hormonal method of contraception or any hormones taken for any other reason, they increase the risk of breast cancer. But it totally depends at what age you have taken the contraception or any hormones and for how long you have taken it. So because when we stop the hormonal method of contraception or when we stop the hormones, the risk also decreases at the same time. So it increases the risk when you're taking it and for how long you have taken it. So that you have to specific cases, you have to discuss with the physician that is it okay to continue for that long or not.
And doctor, when should ultrasound or MRI be used instead of or in addition to mammography?
That's a very nice question because we normally every time we face patients, they're coming that why didn't you do the ultrasound? Because many of the ladies, one thing I would like to discuss about the investigations which we do to diagnose any changes or for screening. First and foremost thing, we go for mammogram. Many of the ladies don't want to do the mammogram because they say the risk of radiation is more and it may cause breast cancer. I would like to put one thing regarding the mammogram. Definitely mammogram is a radiation, but the level of radiation is not that high. If you are traveling by air for 3 hours, that gives you exposure to 1 millisievert of radiation. That means if you're traveling for 12 hours, you'll get same radiation exposure as just one mammogram. So it's like traveling in air. If you're traveling in air for 12 hours in 1 year and you got that same radiation. So the exposure to radiation is not much. Now, when it comes to mammogram, it is the first method which we use for screening. Then if in the mammogram, we feel that, okay, the thing because the breast is dense, we might be missing something, we go for ultrasound of the breast. Or if the lady is less than 40 years of age, they tend to have more dense breast, then we go for ultrasound of the breast. But saying that, okay, let's do the ultrasound and not go for the mammogram, it doesn't go like this because some things are seen good in mammogram and some things are seen better in ultrasound. So it depends on the age and what we are trying to look at. When it comes to MRI, the basic things are mammogram and ultrasound. If we feel okay, no, we need further investigation depending on the results which we have, then we go for MRI breast. Otherwise, we don't go routinely directly to MRI breast and for the screening.
Thank you for the insightful answer, doctor. Here we have also a great question. Does breast cancer treatment affect women's fertility in the long run?
There have been times, I have a patient, she had 5 babies after taking full treatment of breast cancer, whether it was chemotherapy, radiotherapy, or surgery. So we're looking into those who had breast cancer. They are conceiving. So I think that during the time of the treatment, definitely it's difficult to conceive because you're taking chemotherapy. There are more chances of having miscarriage, but fertility treatment, most of the time they're doing fine.
Is it a must for a woman who have breast cancer to follow up with a psychiatrist?
Must in the sense, for that matter, any cancer is stressful. The taking treatment, it is stressful for you and stressful for the family as well. So if you feel that you need help, I think there is no thing, you should not be hesitating to go to a psychiatrist to take the help.
Doctor, one of the audience is inquiring about sugar consumption, and is it linked to a higher risk of breast cancer?
Right now, it is not fully understood that what diet is and how much taking of that diet will lead to breast cancer. But they said, if you are overweight and obese, it increases the risk of breast cancer. When it comes to our taking less fiber and fruits, it increases the risk of breast cancer. But directly, how much sugar you're taking more sugar, or you're diabetic, that increases the risk of breast cancer, not directly.
Doctor, what about cysts in the breast? Do they lead to cancer?
As I said, not all the things which like cysts, which are different from the normal, doesn't mean that they will increase the risk of breast cancer. No, there are cysts which are normal, and with the age, many times we find so many cystic changes in the breast. No, there are particular type of cysts which we are looking for in case there is for the breast cancer, to say, okay, this will lead to breast cancer, but not all cysts will lead to breast cancer. No.
That cleared things up. Moving on, doctor, is it recommended for males to undergo breast cancer screening after a certain age?
Right now, we have the evidence has not proved that okay, the male should undergo because the chances of having breast cancer are very less. And the thing is, with the males, one thing is because the breast size is very small, it's easy any changes in the breast will be diagnosed earlier. So I would just recommend males to look for any changes in the skin which they can find.
Doctor, moving on to lifestyle and exercise, is there any link between exercise and breast cancer?
Exercising and keeping your weight under control within the normal limits, like which we call as BMI, like how we calculate the weight is according to your height. So if it's within normal limits, below 25, definitely decreases the risk of breast cancer, because overweight is a risk factor for breast cancer. So you need to keep exercising.
Doctor, for our final question, let's address this one. Women who undergo chemotherapy or hormonal therapy, their appetite gets affected. How to overcome these side effects that is related to food intake and digestive system?
So, I mean, when you are taking your chemotherapy is going on, you're diagnosed with breast cancer. That's a difficult question, because I would suggest that it to be referred to the nutritionist, because I think it's a difficult thing to manage during the chemotherapy. But the thing is, you have to take care that you have to stick to the diet, listen to your body, what it wants or what doesn't want. Because what I have experienced from my patients, they normally don't want to have something spicy, and at that time they want something more, blend and filling. So I would suggest stick to the nutritious diet. That is more important. If you don't, definitely it is, when you're taking chemotherapy or hormonal therapy, it is affecting both your mind and body. But you have to keep it up, because it is about you, not about just the body and taking chemotherapy. You have to be healthy. You have to take care. Okay, I need to have food. Let me take it. But that is the only way out. Like how you are fighting as a Galilean person against the breast cancer, you have to supply nutritious diet so that your body can help and fight against the breast cancer and can stand chemotherapy.
Thank you, Doctor. That clears things up. With that, we will wrap up the Q&A session. Thank you once again, Dr. Deepti, for sharing your expertise and valuable insights on such an important topic. Thank you, Doctor.
Thank you. Thanks for having me.
Dear audience, this is the end of our webinar. Thank you for joining us and participating. Please take a moment to answer the survey questions. Your feedback and input are appreciated. Moreover, please note that you can view the replay of this current webinar as well as previous webinars in our YouTube channel, Zafaranah Insurance. Looking forward meeting you all again at our upcoming webinars. Stay safe and enjoy the rest of the day.